Globally, over 13 million people have a stroke each year, and around 5.5 million will die as a result. Worldwide, 1 in 4 adults over 25 years of age will have a stroke in their lifetime. Stroke is becoming a fairly common word in our vocabulary, and it is crucial to understand what it really entails. What is stroke? A stroke is said to have occurred when the blood supply to any part of the brain is cut off and that brain tissue is damaged due to lack of oxygen and nutrients. The function related to the damaged brain tissue is subsequently affected or lost, leading to disability and sometimes even death. What causes a stroke? The most frequent cause is a clot that forms in a blood vessel supplying the brain and blocks the blood flow. This is known as an ischemic stroke, and it is the commonest type. The blood supply can also be compromised due to bursting of a blood vessel, which is known as a hemorrhagic stroke. Here, we focus mainly on stroke, which occurs due to formation of blood clots, as there is an emergency treatment available, which can be life-saving. Certain factors increase the risk of having a stroke, such as high blood pressure, diabetes, high cholesterol, atrial fibrillation, and other heart diseases, smoking, alcohol consumption, diets high in saturated and trans fats, cholesterol and sodium, obesity, physical inactivity, and advanced age. The risk factors make it clear that stroke is absolutely preventable, and it is actually very simple. Adopting a healthy lifestyle is key to preventing stroke. Healthy food habits, adequate exercise, sufficient sleep, refraining from smoking, alcohol consumption, and drug abuse can significantly reduce the risk of stroke. When conditions such as high blood pressure, diabetes, and high cholesterol are present, it is essential to seek appropriate medical measures to have them under proper control, which also helps in risk reduction. What are the symptoms of stroke? Remember the letters in the word fast. F. Face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the person's smile uneven? A. Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? S. Speech difficulty. Is speech slurred or garbled? T. Time to call 1990, the Suvasaria ambulance. The Suvasaria ambulance service can also be accessed via the Suvasaria 1990 mobile app. Where should you go in case of stroke? Seek the nearest healthcare institution where CT imaging facilities for diagnosis and clot-dissolving drugs to treat strokes caused by clots are available. This map shows the hospitals which are adequately equipped for stroke management. Treatment for stroke depends on where in the brain the stroke has occurred, its type and severity. It is mostly treated with medication to prevent or dissolve clots, as these account for the majority of strokes. It is important to know that for thrombolysis or clot dissolving to be done, the person should be brought to the hospital within 4.5 hours from the time of onset of stroke. Sometimes surgical procedures may be required. The sooner the treatment, the better the outcome. Having a stroke is not the end of life. It is treatable if timely action is taken. So, this is our message to you. Time is of essence. Do not let it tick, because each minute matters. Brain is time.